That's okay. Can you guys hear me okay?
Yes.
Okay, great. Thank you very, very much for that, Katrina. We want to get to some practical examples of reporting and talk about the applications. So these next couple of slides I actually won't speak to. I'll just highlight for you that the NCCDH, in collaboration with the other NCC, so this is actually a collaborative product. I provided the link here on our website, and it's for the Equity Integrated Population Health Status Reporting Action Framework. And so this is a framework to help guide public health practitioners in their health status reporting processes. The whole idea behind this framework is that knowledge mobilization is at the center. So you want to consider that from the very beginning of any health status reporting you do. In the same way in public health for years we've been saying, plan the evaluation from the beginning of the program, not at the end of the program. Plan your knowledge mobilization at the beginning of your process, not at the end when you're wondering what to do with it. So that's all I'll say, and I'll let you go to the document for more information. And if you've got any questions, then let me know. So what Katrina and Bruce and I really wanted to do to bring this to a very practical level is to look at some really specific examples of different styles of health status or health reports and talk about what their what the strengths are and what some limitations in terms of the use of these style of products. So this first link that I'll provide to you is for the Children's Report for Prince Edward Island 2017. And here's the link for you to take a look at some point. This is a larger report, but it has a very clear introduction that refers to social determinants of health and the measurement of those social determinants. It talks very specifically about social and economic demographics, and it really highlights those key findings related to the social determinants of health. It's a long report. It's 73 pages. It's not presented as a health equity report, but it contains health equity related messaging throughout the report, and it's focused on one central issue of child health instead of the health of the whole province. So this is an example of still providing a really deep and large report, but on a specific topic and with an equity focus. So I wondered if Katrina and Bruce had any comments about this. I know that they've taken a look. Bruce, did you have anything you wanted to add to that for a product like this?
A product like this, I like how you say that it's not a public health report, but it is, and it really to me feels like what could easily be a chapter of a bigger report or one section of what Prince Edward Island would have reported as their overall thing. So I think you're exactly right. It is kind of that. From going through it, I think I agree with you that it's really neat how they picked something and were so focused sort of on children and on the social determinants of health. And I thought it was pretty interesting information in there. That report didn't speak to me from a sort of media guide. Just when I looked at it, when I first opened it, there was just too much text. And it kind of wasn't broken up, and I felt like a little bit the audience is maybe the public, and it's a pretty broad audience, and it wasn't very inviting to me. There were some nice pictures of kids, and they look great, but overall I found it a little bit daunting, and I really had to work to read through it and get the information out of there. So I think it's a good example of them focusing on an issue and really bringing out good info, but I personally didn't like the way that it was presented very much.
Katrina, do you have thoughts?
Yeah, so when I see a report like this and I think, wow, there's so much really rich information here, and I would love to take something like this and see how to now engage people on Prince Edward Island with it. So could you take pieces of it and create a really accessible, high-level, maybe visual overview and then invite some conversation about what to do with it, because we can gather all the information, but then if we want to motivate action, we need to think about how our reports are shared. So the mobilizing part isn't just about creating the report. It's about what you do with that report next. So that's where I would, I think there's just so much opportunity to use, like, I agree with Bruce, it's like the focus and bringing in the social and economic determinants of health is really promising. But now, how do you actually start a dialogue about it? How do you know whether people care enough about this for action to be possible?
Yeah.
So that's what I would, yeah.
Yeah, and that's helpful to hear. So the audience knows that the three of us haven't actually talked about these together. We've looked at them separately and thought we would have the discussion here. So I'm just finding it really interesting to hear your perspective. And what that says to me is that maybe when we produce a report, and this is a very strong health equity related, with health equity related messaging, but maybe when we produce a report, this isn't the end of our reporting.
Yeah.
Maybe, you know, what you just said, Katrina, about that how do we engage the province with it and how do we engage people with it? That's the next phase of the quote-unquote reporting process. And I can't remember if one of you has said this already or if we're going to say it later, but we talked in our planning about the difference between a report and the reporting. And that there are differences in that, and so maybe you know, something like this is very rich, and they do a very good job of integrating those equity messaging. The reporting piece can continue from this, I guess.
Yeah, like it's a platform to, like, there's just so much potential here, but if you don't actually steward it through in a way that's very inviting and strategically so, then the people who this will have influence on is going to be limited to people who have who find it, who it's relevant to. So I could imagine, I'm sure that like MPH students would be all over this, and this would be great for them, and they would take that forward, and maybe they would think about creating their reports using this as an exemplar. But then it's the reporting part, the active part, that needs more, that's sort of left unanswered with just looking at the report.
Very good. Okay. I'd like to take a look at another one. So thinking of going from a bigger report and moving beyond that into something that's a shorter report. This is a link to a report by the Thunder Bay District Health Unit, and this is their Social Determinants of Health report from 2017. And so this is a report that's specific to social determinants of health in their region. And so the social determinants focus is very clear, the equity focus is very clear. There's clear identification of stats that are considered, you know, what is a social determinant of health. Oh, and I'll speak louder here. Sorry, everyone. You know, there are clearly stats such as income, employment, food security that are considered, you know, quote-unquote social determinants of health. It looks at local stats. It compares it to provincial rates. And it also presents the statistic, and then there's a statement that goes along with it about its impact on health, or the impact of that social determinant on health. And it's a much shorter report. It's a handful of pages, I think, in comparison. So, Bruce, did you have any thoughts on this one?
Yeah,
and again, before you get into it, I want people to understand we're not evaluating his reports. We're just looking at what the application and sort of what next steps, right, would be.
Mm-hmm. Yeah, totally. And I thought this one was great. It's almost what we just talked about, I think, could have been the next step on the last report that we saw, so it's not quite as in-depth. And so if you were really looking to dig into a bunch of these social determinants, I think then you would have to try to look for another report or follow up some of the links that they have here. But the way that it's presented, I think, is pretty user-friendly, but there's still enough information there that you didn't just see some dancing bear that caught your attention and didn't really tell you anything. So I think this one's great. I like the way that it's laid out, and I think depending on who your audience was, using that last report, you might say, okay, here's something that we're going to put in the waiting room of our clinic, or we're going to take it to the school board or to the town council or something like that, just to sort of to get them in the door. And so to me, I like this one a lot. I think it's pretty good.
Cool. Katrina, did you have any thoughts?
Yeah, well, I think there's aspects of it I really like, and then there's parts of it that leave me kind of with some questions still. So one of the things that I noticed is that, two things I noticed. One is that I don't really know the so what. So I see these things, but like this is a good summary of the status, but I don't know the so what do we do, or where's the action, or what needs to be done, or what are the possibilities, or what should we be caring about, or whether is it acceptable that this is that 87% have a regular doctor. Is that unacceptable? Like, so there's no stand taken on any of these. And then the one, I like that they included stress. I think this is important. But there's also, so I'll just gently challenge, with all respect to the effort that's being put into this, I think there's a tendency for us to place the most deeply rooted causes into individuals. And that's not because anyone wants to do that. It's because the lenses that we're given to look at the world through tend to do that and tend to hide the most deeply rooted aspects, the more structural determinants of health. So when I look at Indigenous status being reported as a social determinant of health, it's actually not indigeneity. It's not. My Indigenous ancestry isn't what determines my health. It's the history related to the treatment and positioning of Indigenous people that make all of these impacts on health that are listed here. They are at more risk, yes, but it is not because they're Indigenous. It's because of institutionalized racism and colonization. So those things are not named, and when we don't name them and we don't acknowledge them, what it actually ends up doing, if we remember back to the slide I had about that orientation to root causes, I would actually classify this one as in actually probably disregarding. So I would put this in a less productive orientation. So it is clear that the intention is to be more productive. So I would wonder, what could we do to help make it more possible to have conversations about those deeper structural root causes instead of looking at the symptom levels of what's actually going on with health equity issues.
Yeah, that's great. Okay, that's great. I want to look really quickly at the next example, and maybe we won't say too much about it just for time, but someone just made a suggestion, Heidi just made a suggestion in the chat box about maybe it could be a dashboard. And so this is a dashboard type of reporting tool from Saskatoon, and it's part of their Community View tool. The link is here. And what I use the HIV special report as an example. One of the strengths here is that it's online, it's continually updated. Of course, that takes a lot of resources, but if there's a way to do that in a feasible way, it's a consideration. It essentially replaces those really long data reports. There are sections on population health and poverty reduction specifically. There can be a downloaded printable version of this, and there's a Learn More tab. So you can see on the HIV special report graphic at the right, the first yellow stat, the yellow graphic is testing, and I've circled where it says Learn More. And when you go to the Learn More tab, you can actually get information on the data on the health risks of that condition. And in the case of the HIV one, there are actually some stories from the front line, from some practitioners, from aspects of the community. And so that makes me think about the importance of integrating community stories with our reports that maybe would give it some of that context. So something worth considering too. But Bruce or Katrina, maybe I will just give you a second. Did you have a comment about this one?
Just a 1 minute. I like this too. I sort of just love the way they've used technology. Right, you can drill down as much or as little as you want to, and so the way that they've embraced that, I thought, was pretty good. It's exactly what you said. Do you have the time and the money and the resources to do that? Because I think one of the things we've struggled with in Manitoba is just that I think everybody would like real-time, sexy 3D data that we can get at any time, but do we just have the resources and the expertise to do it? And this looks like a little bit of a step beyond the paper report to me, and so I like it. I didn't dig way deep into it.
Yeah. No.
Yeah, I agree. I think this is inviting, and it's like, I like that it's interactive, and it gives people opportunities to have this sort of blend of visual, and they've also done a good job of not making indigeneity the problem, but also still not overlooking the importance of that as a consideration. So the only thing I would wonder, and I haven't dug deeply enough, and maybe it's in here, is the so what part. So what do we need to do about it? Or is this acceptable?
Right, and that's the actionable piece, right? And how do we actually turn some of this stuff into action? I included here two examples as innovative examples that I'll just we'll have to skip over for time, but wanted people to just consider that reporting can be done as a graphic recording. It can be done as a whiteboard video. There are other maybe ways to report depending on who your audience is and depending on who we want to have access to that information. I do want to take a minute to do maybe just one voting poll before we get to questions. So we thought we would get your thoughts now that we've talked a little bit on different styles and different reporting types. Maybe your thoughts on a couple of formats. So what would a large data report, or when would a really large data report be the most useful? And the most useful, because it might be useful for different audiences. Is it good for staff education? Would it be good to take to the community for a consultation? Is it better suited to MOHs and leadership? Is it when bringing partners on board, or are there other places? And if you've got other suggestions, put it in the box. Heidi's just said maybe it's most beneficial when you're looking to reproduce a methodology around the reporting. So that's a really, really good point. Interesting. And I'm not surprised to see that a lot of people feel like it's probably most suited to maybe presenting to MOHs and leadership or stakeholders. That's
Dianne, I'll tell you a quick little story that sort of reinforces this. So we, in terms of tailoring something to your audience, and that a big report like this might be right for the MOHs, Randy Gazelle is a MOH in Manitoba who's about to retire. A brilliant guy, and diabetes is kind of his thing, and we opened up a giant report on diabetes, and it was a whole page full of numbers, and he got up and started floss dancing because our diabetes numbers were getting better. But I mean, to him, that spoke to him 100%. He could interpret that data right away, and he was excited about it, and he honestly got up and danced about a page full of numbers. So
that's amazing.
Large report like that was the right thing for him, right? And it's the right thing for some people, but maybe a community consultation, we wouldn't have had too many floss dancers.
And no, maybe not. Maybe not. This is getting lots of comments, so I am going to do one more, and then we'll go to questions. What about the one that we, similar to what we just looked at from Saskatoon, or I've highlighted another one here from the Public Health Agency of Canada on the highlights inequalities in oral health, and this is a one-page dashboard fact sheet style. When would something like an infographic or a dashboard style be the most useful? And I've used the same types of options, and just to see with a comparison of when we might think this might be the most useful. And again, if you've got comments around other, please put it in the chat box. And just so people know, if you're interested in getting a report of some of the resources that have been shared and some of the comments here in the chat box, certainly we can make that available to you if you're interested in that. So again, I'm not really super surprised to see here that most people would think this might be the most useful in a community consultation, you know, when interacting with the community, and maybe the community with the grounded expertise, lived experience, engaging the community when we talked about the PEI report, and then how do you engage citizens of a province around the issues. You know, maybe something like this could be the next step. This is really interesting. Thanks, everyone. I really, I love this kind of stuff. Thank you. So with that, I think I'll skip the next one and go right through to discussion, but please keep your comments coming into the chat box, because this really helps us with not just with our next steps with these webinars, but with our work in general, and all three of us in thinking of where to go next. So we do have a few questions from the audience that I'll bring out for the speakers. If you end up needing to leave early, I've got the evaluation survey up here. Please, please, please fill it out. It will not take you long, I promise. So one of the very first questions that we had at the beginning was, how do you, if you've got a really big report, this was from Judy, how do you tailor that report to make the information easier to find? So if you've got 600 or 300 or 100-page report, we saw some suggestions come in, but Bruce or Katrina, do you have any comments on this?